Inelastic impression materials. Impression compound. Based on resin. When you heat, it becomes soft, and once you place it in the tray and insert it in the patient mouth, the material will harden. Also, we can soften it again and reuse it. Used for impression of edentulous patient. There are two types of impression compound, sheet and stick. Sheet used for primary impression of edentulous mouth. Stick used for border molding in final impression. Composition: natural resin, waxes, stearic acid, filler, and inorganic pigment. Resins: amorphous organic substances which are insoluble in water, make thermoplastic. Straight chain hydrocarbon: tasteless, odorless, colorless, make thermoplastic, like beeswax. Stearic acid: lubricant and plasticizer. Fillers: control degree of flow, minimize shrinkage, improve rigidity. Properties: reversible physical process, softens by heat, harden in the mouth. Avoid overheating because it loses acids and altered characteristics. Softening temperature is between 55 to 60 centigrade. The flow is increased by increasing temperature. The material has a high viscosity and considered as a mucocompressive. It applies pressure onto the tissue. High coefficient of thermal expansion. The rigidity increase with using rigid tray. Poor thermal conductivity. Take time during heating or cooling. Should be poured as soon as possible. Since the pressure is applied during formation of the impression, the residual stress occurs in the material storage in warm environment or extended storage result in warpage. Contraction of impression compound from oral temperature to room temperature is 0.3%. Tray selection. Select stock edentulous trays with short flanges so as not to distort vestibule. Impression compound sheets manipulation. Softened by heat using water bath. Primary impression was taken using impression compound. Low fusing compound, green compound, sticks used for border molding. What we mean by border molding? Border molding is the shaping of an impression material by the manipulation or action of tissues adjacent to the border of an impression tray. Border molding can be functional or manual manipulation of tissues. Duplicates contour and size of impression compound can be softened by heating over the flame or water bath. Border molding can be performed with thermoplastic molding compound. Heating compound. Use Bunsen burner. Warm until it starts to drop. Do not overheat. If catches fire, or boils. It will not mold properly. Compound application. Apply over the periphery of the tray in a thickness just slightly narrower than the compound. Resoften after application. Tempering compound. Temper in water bath between 55 to 60 centigrade for several seconds to prevent burning. Hot water bath will keep compound soft for an extended period. Inserting the custom tray. Place it intraorally by rotating into place. Mold by pulling on the cheek, lips, and have the patient make functional movement. After removal, chill in cold water. Trim excess over external material that is thicker than 4 to 5 millimeters. Clean debris from the assessing peripheral roll, proper thickness, and no overlap. Advantage: can take impression again. Compatible with the model material. Advantage: very technique sensitive. High coefficient of thermal expansion leading to dimensional changes. Mucocompressive. Must be poured within 1 hour. Low detail reproduction. Thermoplastic materials cannot record fine details accurately because they undergo permanent distortion during removal from the tissue undercuts. Zinc oxide eugenol impression paste. Zinc oxide eugenol used for full arch edentulous impression without or with minor undercut. Used for wash impression. Used for bite registration, temporary cementation, temporary. Zinc oxide eugenol wash impression. Zinc oxide eugenol used also for bite registration, temporary cementation, temporary filling. Zinc oxide eugenol impression paste. Indications: these pastes are rigid when set and can be used only when there is no bony undercut because of the difficulty in removal from the undercut area, which may lead to trauma or breakage of some pieces of zinc oxide impression. Used in a close-fitting tray, and so the overall bulk of the impression is kept to a minimum. This is useful where the denture-bearing area is reduced due to bone resorption. Contraindications: not used in patients with a dry mouth because the paste tends to adhere to the oral mucous membrane. When the patient is intolerant to eugenol, as it can cause a burning sensation in some individuals or irritation. Potential impression materials: zinc oxide eugenol, fast-set, rigid. So there's difficulty in removal from the undercut area, which may lead to trauma or breakage of some pieces of zinc oxide impression. Poor taste. Zinc oxide eugenol considered as a mucostatic impression of edentulous ridge. Initial setting time between 3 to 6 minutes. Final setting time is 10 minutes. Two pastes, different colors, equal length, different size. Not elastic. Temperature and moisture reduce the setting time. It means they accelerate the reaction. Drop of water can accelerate the setting. Pour any time. No separators needs. Put Vaseline on patient's lips. If patient irritant to eugenol, use rubber impression material or eugenol-free zinc oxide impression. Hydrophilic, accurate reproduction of surface details, dimensionally stable, compatible with dental stone, separated by softening the set paste in water at 60 centimeters. Hard and brittle when set, used for edentulous patients, can be corrected. The mixed materials has adequate adhesion to acrylic or tray material, therefore adhesive do not need. Major restriction is their lack of elasticity, not suitable for deep undercut, bilateral undercut. Difficulty because of difficulty in removal from undercut area, which may lead to trauma or breakage of some pieces of zinc oxide eugenol impression. The set material easily distort or fracture when removed from the undercut. Composition of the base: zinc oxide, oil vegetable or mineral as plasticizers, traces of water as an initiator. Composition of the reactor: eugenol, oil of cloves, gum as an accelerator, filler, silica, balsam, improve the flow and mixing properties, accelerating solution and coloring agent, lanolin, non-eugenol paste, contain carboxylic acids. The chemical reaction: zinc oxide powder mixed with eugenol liquid resulted in zinc eugenolate and zinc oxide, which is unreacted. Mechanical properties: very low viscosity, irreversible chemical change, low dimensional change. Coagulation: equal length of the two paste is extruded, mixed with stainless steel spatula in paper pad or glass slab. Mixing time is 45 to 60 seconds. Working time 3 to 5 minutes. The working time shortened by increasing in temperature or humidity. Manipulation: equal length of two paste is extruded, mixed with stainless steel spatula in paper pad or glass slab. Mixing time is 45 to 60 seconds. Acrylic special tray with border molded, using low fusing compound, ready for making zinc oxide eugenol impression. Working time is between 3 to 5 minutes. Inserting in patient mouth after applying Vaseline on the skin. The final zinc oxide eugenol secondary impression: accuracy of soft tissue impression, mucostatic, good dimensional stability, good surface details reproduction, inexpensive, adhere well to dental compound. Disadvantage: messiness, unstable setting, may irritating to soft tissue. Bite registrations taken by the dentist or dental assistant make a reproduction of the occlusal relationship between the maxillary and mandibular teeth, provide an accurate registration of the patient-centric relationship between the maxillary and the mandibular arches. Zinc oxide eugenol paste has little to no resistance to bite closure and is a fast-setting material. Material is supplied in a paste system and dispensed onto a paper pad, mixed and placed on a gauze tray for the patient to bite into it. Impression wax, like Corquita wax, Iowa wax, Max clinical uses, preliminary impression for edentulous patients, bite registration, and functional impression.